experiencing scar pain during pregnancy, here's the thing. You want to make sure you see a therapist in person because you want to make sure that the pain you're getting is coming from your previous scar and not from a complication being caused by the pregnancy itself. So just be on the safe side, see a therapist for C-section scar pain during pregnancy. If your internal cesarean scar is sore, but your external one is fine, here's the thing. If you watched the workshop that I did on Monday, I talked a lot about how people often massage superficially and they don't get deep enough. So if you're not quite sure if this is you, first of all, you don't want to go super deep until you've done some superficial techniques first anyway, and then you are at least 3 months postpartum. Going deeper into those tissues requires a little bit of expertise, but also, you want to know what you're doing and you're doing it correctly. So rewatch that workshop. I walk you through a lot of those tips. And if you have specific questions, make sure you ask me in the comment section below. Not being stitched up straight after your cesarean is actually not uncommon, and in my experience hasn't really affected how well someone can heal. So how do you know you're not stitched up straight? Well, that linea nigra, or that dark line down the center of your abs, may not line up. So that's how you can tell. Of course, that's superficial, and internally you may be stitched up perfectly straight. So does this affect healing? No. When it comes to scar massage, you essentially stick to the same rules, which is, can you get your pain to disappear, and also can you match the mobility of healthy tissues above the surgical area? And the other part is strengthening. So making sure you're doing the right movement in recovery. That linea nigra ends up fading within a couple of months anyhow. Along with that previous question about a raised bumpy scar or a hypertrophic scar, and this question about keloid scars, I have seen a lot of success with really great scar tape. And the scar tape that I loved by Spider Tech Tape is no longer being carried, but I am almost positive that I have sourced a really great replacement, which is exactly the same tape, just carried by a different company. So following up on them, I will have news for you hopefully within the next few weeks, but let me know if this is something that you are interested in, because scar tape can make a huge difference in keloid and hypertrophic scars. I will note about keloids, if it's itchy or painful, please see your doctor. Oftentimes there are some injection therapies that could be quite helpful, and immediately. If your external scar doesn't really move downwards the same way that the non-surgical part of your abs do, then you gotta start pulling and holding it downwards. So this mama here is in my cesarean recovery program, and she's on the second of 4 modules, and so she has been pulling upwards, and what she needs to do is just pull down. Pulling down so that she gets to the end of that skin mobility, and depending on where she is in terms of her healing, 2 out of 10 pain is perfectly fine. You want to get that stretch, and you want to hold it. You're going to hold it for 5 to 10 nice gentle belly breaths, and at a certain point you're going to start to feel the tissues kind of giving. So once that happens, then you let go of your pull and hold, work along the entire scar, especially the areas that are most restricted, and don't forget to follow up with a cesarean specific movement to hold all those changes. How hard should I press when doing my own scar massage is one of those questions you need to ask yourself all the time. So when you work with me during my cesarean recovery programs, you'll know to answer 2 questions. 1 is, what is my pain? 2 is, what is my mobility? Let's talk a bit more about what that means.